Hello, guys. It's a wonderful day wherein I want to say a few things about dental implants. Now, basically, I want to concentrate on a fact regarding dental implant body size, a biomechanical and a aesthetic rationale. Why biomechanic of dental implantology is very important for us because when we place the implant inside the jaw or the bone, we expect it to be stable and, of course, take the load of the mastication or the chewing. That is our expectation from dental implants, not only us, even the patient to expect in the same manner. So the initial treatment plan for implant dentistry should include an ideal implant size based primarily on biomechanics and aesthetic consideration. Okay. So in traditional prosthetics, when a tooth is replaced, the abutment teeth are already provided by nature with wide posterior abutment for posterior teeth. That's very important for us. So what happens exactly in that moment? The size of implant used to be determined primarily by existing bone volume in height, width, and length. The surgeon should select longer implants in anterior regions of the mouth and shorter ones in the posterior area because of the limit of the mandibular canal and the maxillary sinus in the maxillary and the mandibular arch. So these things are very important for us. So the width of the implant is also determined at surgery would relate to the existing width of the available bone, and one diameter implant would be used in almost all situations. So, over the years, dental implant treatment plans incorporating biomechanics has been advocated by mesh to decrease the most common complication, those related to the stress. Very potential complication. This implant system breakdown. If it is not planned properly, it will break down and it will lead to loss of the faith in the. I mean, first of all, it will lead to the loss of the tooth structure and implant will fail. And secondly, the loss of faith in the patient mind. So, what is important here? Aesthetics and biomechanics. Now, the patient force factors are then considered to evaluate the magnitude and type of force applied to the restoration. And the bone density is important part. It is evaluated in the region of potential implant placement. The key implant positions and the implant number are then selected in relation to the patient force factors and the bone density in the implant site. So, a comprehensive approach is required for overall dental implant size and begins with the identification of the clinical problem to be addressed. Fundamental scientific principles related to force and surface area are then combined with engineering principles to pursue the desired clinical goals. When relevant, aesthetic consideration is regard to implant size are a part of the evaluation. So, we are here to discuss about the aesthetics, the biomechanical, the longevity of the treatment, the stress strain models, whether, and of course concerning the vital structures and all, and of course tolerating the flexing of the mandible and the jawbone. So at current day clinic, we're very much entitled to take care of the fact that your smile is our treasure as good as your treasure. Any query, you can message us and tell us. Thank